Hi, welcome everybody to our re-recording of our third session in our guidance webinar series. And thank you for taking the time to come and review this session. My name is Leslie McFarlane. I am the portfolio lead for the Healthcare Staffing Programme. Next slide, please. In this session, we hope to provide an introduction to the Health and Care Staff in Scotland Act and the statutory guidance and the staff roles that are subject to the Act. What we're going to be discussing today is the common staffing method and the role of Healthcare Improvement Scotland with their monitoring and compliance roles, and this will be as it applies to health. There is another webinar that will cover social care. What we also want to do within this session is to signpost people to take part in the public consultation on the statutory guidance that's been drafted, and we'll be giving you more details about that further on in the session. Next slide, please. So without any further ado, I'm going to pass you over to today's presenters, who are Catherine Brechin, who is a professional advisor to Scottish Government, and Sarah Cartwright, who is a policy officer in Scottish Government. So thank you.
Thank you, Leslie. So I'm Catherine Brechin and I'm a professional advisor with the Chief Nursing Officers Directorate. As Leslie has said, the focus of today's webinar will be the common staffing method and the role of Healthcare Improvement Scotland post-enactment. But first, I'd like to provide a brief recap of the Act and who it applies to, as well as give a brief summary of the general duty and the guiding principles, which were covered in the detail in webinar 1. So the Health and Care Staffing Scotland Act was approved by Parliament in 2019. However, implementation was paused due to the COVID-19 pandemic. Following an The aims of the Act are to provide a basis for the provision of appropriate staffing in the NHS and in care services, and through this enable safe and high quality care and improved outcomes for service users and people experiencing care. So whilst the duties in the Act are new, the requirement to have appropriate staffing and deliver safe, high quality care are not. The Act builds on arrangements that are already in place for both local and national workforce planning and health and care services. Implementation of the duties will support decisions made about staffing requirements, service delivery models and service redesign. The Act will also promote transparency and support an open and honest culture where staff are engaged in processes, informed about decisions relating to staffing requirements and feel safe to raise any concerns. The Act enables the Scottish Ministers to issue statutory guidance. So statutory guidance aims to explain the provisions of the Act and assist organisations affected by the Act in implementing the requirements of the legislation. So draft statutory guidance has been prepared by the Scottish Government in collaboration with key stakeholders from across the health and care sectors to ensure it's clearly presented, coherent and accessible. And we'd like to just take a moment to thank everybody for their contributions to the drafting of the guidance chapters. The commitment and support and feedback have helped to shape the draft guidance that we have. So the aim of this suite of webinars is to raise awareness of and introduce that draft statutory guidance or the guidance chapters as they've become known. So a public consultation exercise is being held on the guidance where you'll be able to have your say, and we'll discuss more about that and how you can engage with that at the end of the presentation. So next slide, please. There are 4 parts to the Act. Part 1 is the guiding principles for staffing. Part 2 is staffing in the NHS. Part 3 is staffing in care services. And Part 4 are general provisions. And the focus of today really is around staffing in the NHS. The Act places different duties on different parties involved in the provision of health and care services. And these are shown in the slide. Those delivering health and care services are responsible for arranging or contracting those for services, and examples are territorial health boards, our special health boards, common services agencies for the Scottish Health Service, local authorities, integration authorities and care service providers. But there are also specific duties within the Act concerning Healthcare Improvement Scotland, the Care Inspectorate and the Scottish Ministers. Healthcare Improvement Scotland and the Care Inspectorate have been commissioned by Scottish Government to support NHS providers and care service providers prepare for the Act. However, following enactment, they will have specific duties and powers in relation to monitoring compliance with the duties and in relation to staffing level tools and staffing methods. The duties for HIS will be covered today, and for the Care Inspectorate, this will be addressed in our webinar 4. So in regard to the staff groups and staff roles that are included in the Act does not list which staff groups or staff roles are included in the provision. However, Scottish Government has published guidance as to which roles would be included, and this is available on the consultation page that you'll be signposted to later on in the webinar. This list doesn't form part of the statutory guidance, but will sit alongside it as a living document to allow it to incorporate any new roles or professions that emerge over time. So for healthcare, broadly speaking, it is clinical roles that are included within the scope, such as nurses, doctors, dentists, allied health professionals, healthcare scientists, among others. Non-clinical roles such as domestics and maintenance staff are not within the scope of the legislation. However, their critical and essential contribution to delivering healthcare is equally important. In relation to the common staffing method, this means those staff or employees stated in the guidance only. Next slide. Section 12IA is the duty to ensure appropriate staffing, and it was covered in a bit more detail in the first webinar. If you've missed this, a recording is available and you can go back and view at your leisure. However, we will recap briefly on this duty as it's relevant to the other duties and responsibilities we're going to cover today. Section 12IA states that it's the duty of every health board, relevant special health board, National Services Scotland, to ensure that at all times suitably qualified and competent individuals from such a range of professional disciplines as necessary are working in such numbers as are appropriate for the health and well-being and safety of patients, the provision of safe and high quality healthcare, and insofar as it affects those matters, the well-being of staff. So the aim of the duty is to enable provision of safe and high quality services which meet the needs of service users through having appropriate staffing with the right person, with the right skills, available in the right place and at the right time to provide that person-centred care. Next slide, please. This general duty to ensure appropriate staffing must be discharged with regard to the guiding principles of the Act. And again, further about this can be found in the recording of the first webinar. Next slide, please. Most of the other duties in Section 4 of the Act, which is on staffing in the NHS, exist directly to support the overarching general duty to ensure appropriate staffing, and the duties highlighted in yellow are the ones we'll be considering in today's webinar. Next slide. So let's move on to talk about the common staffing method. So there are 3 sections under the Act that detail the requirements for use of the common staffing method. So that's 12IJ, 12IK and 12IL. So section 12IJ is the duty to follow the common staffing method and details the process and the different steps that should be applied. Section 12IK lists the types of healthcare, locations and employees that must use the common staffing method, as unlike the rest of the Act, use of the common staffing method does not apply to all staff groups or for all types of healthcare. Section 12IL details the requirements for training and consultation of employees by a relevant organisation in relation to the use of the common staffing method. Well, Section 12IJ also allows the Scottish Ministers to make regulations specifying the frequency at which the common staffing method should be applied and specifying the staffing level tools and professional judgement tools that need to be used. These regulations have yet to go through Parliament, but will do so later on this year or early in the new year to allow them to come into force with the Act on the 1st of April 2024. Next slide, please. So unlike the other sections of the Act relating to NHS staffing, sections 12IJ, IK and IL only apply to specific types of healthcare provided in specific locations by specific employees. These are listed in 12IK of the Act, and we'll come on to talk about those in a little bit more detail. So why doesn't everyone have to use the common staffing method? An important feature of the common staffing method is the use of staffing level tools. A suite of those tools exist and each is specific to a particular type of healthcare, location and staff group. So the list in the Act aligns with the current availability of specialty specific staffing level tools. The Act does allow Scottish ministers to add, remove or change the types of healthcare, locations and employees listed in 12IK. For example, if a new staffing tool is developed for a setting that's not currently listed, Scottish ministers could agree to add that to the list and they would be incorporated into the legislative requirements. Any amendments will require secondary legislation to be passed by Parliament, and until then, only those that are listed in 12IK are required to use the common staffing method. Next slide, please. So in this slide, we have the summary table that's within 12IK. And as you'll see, there are 3 columns here, one that highlights the type of healthcare, one the location, and one the employees. So in that first column, we have types of healthcare. So that's the specific specialty or service. The second column is the location. So which healthcare setting? So here you can see we have neonatal units in hospitals or paediatric wards in hospitals or community settings. And then the third is employees. So that's the staff group or professional discipline it relates to. Note that the common staffing method has to be applied separately for each team or ward that falls under the definition of 12IK. So you couldn't run the tools for 3 or 4 medical wards, for example, but only apply the common staffing method once to all of those as a collective. It needs to be individual ward teams running the staffing level tools and then applying the common staffing method. The next slide will talk more about the named employees in a bit more detail. Next slide, please. So there are 3 types of employees listed in the table in section 12IK. So we have registered nurses, registered midwives and medical practitioners. This includes all grades and bands. Although only these 3 groups of staff are listed, Section 12IK also states that this includes any other individuals providing care for patients and acting under the supervision of or discharging duties delegated to them by the registered nurse, registered midwife or medical practitioner. So, for example, if a registered nurse is supervising a healthcare support worker and delegating duties to them, then they will be included within that type, that staff group, and will be included in the staffing level tool. Section 12IK also details individuals who should be excluded from this definition as an employee. So these include individuals who are undertaking a course of studies in order to be admitted onto the NMC register, and those who are undertaking a course of studies to join the GMC register. So essentially our nursing and midwifery and our medical students. This means that these individuals must be supernumerary to the number of staff required to deliver care. Students who are in clinical areas in a learning capacity not to support the delivery of service and may in fact add to the workload of staff who are directly involved in their supervision and learning. This exclusion does not extend to positions such as apprenticeships and earn as you learn models. However, recognising the range of different pathways to registration for nursing, further direction is provided in the guidance chapter. Next slide, please. For those specialties or service, healthcare settings or staff groups not within the table shared, they are not required by the Act to apply the common staffing method or to report on these duties. However, the various components of the common staffing method and resources available as part of the common staffing method may still be useful in planning appropriate staffing. So, for example, a service may not have a specialty-specific staffing level tool available, but might find it helpful to use the professional judgement tool or to consider measures of quality and consider the other factors within the common staffing method to support them when determining appropriate staffing. And of course, these services still have to comply with the other requirements of the Act. Next slide, please. So what is the common staffing method? The common staffing method sets out a process of data assessment and triangulation, including the use of specialty-specific staffing level tools and the professional judgment tool, as well as a range of other considerations. These different parts should be used together to make staffing decisions. The application of the common staffing method will support relevant organisations to ensure appropriate staffing for the health, wellbeing and safety of patients and the provision of safe and high quality care, along with determining whether any changes need to be made to that staffing establishment or the way that healthcare is delivered. Next slide, please. The common staffing method requires the application of the relevant specialty-specific staffing level tool. A staffing level tool requires individuals to input certain information about, for example, the workload, patients' needs, so thinking about acuity as well as activity in the specific location it's being used. The tool then provides some quantitative information about staffing to assist in determining what an appropriate staffing level might be. These tools have been designed and tested with a specific setting in mind and therefore should be used within the designated settings only. So in addition to the staffing level tool, staff must use the professional judgment tool. A professional judgment tool requires individuals to assess the staffing requirements based on their professional opinion of the current workload and the local context. And again, the tool will provide quantitative information about staffing based on the information that's been put in to assist in determining appropriate staffing levels. The outputs of these two types of tools should be compared with each other and any differences considered along with the other parts of the common staffing method. Details of the tools that must be used for the specific types of healthcare location employees will be prescribed in the regulations and be specified within the legislation. User guides and videos on the tools can be found on the Health Improvement Scotland website, and links for those will be available later. Next slide, please. The next step is to take into account any measures for monitoring and improving the quality of healthcare, which are published by Scottish ministers as standards and outcomes under the National Health Services Act 1978. So, for example, the Health and Social Care Standards. This provides an overview of the quality of care being provided and allows exploration of whether current staffing levels are a factor in this. Following this, the Act then lists a number of factors that must be taken into account as part of the common staffing method, and we'll look at these in a little bit more detail now. Next slide, please. So those other factors include current staffing levels and any vacancies. So what impact, if any, does this have on the quality of care? So, for example, assessment of rosters and rotas, staff absence, vacancy, supplementary staffing use. Next, we look at different skills and levels of experience of employees. So what's the skill mix in the ward? What's the knowledge and experience of the staff? And does that impact on the quality of care? We need to think about the role and professional duties of any individual with lead clinical professional responsibility for that particular type of healthcare. So thinking about time for clinical leaders to undertake their duties. And that was discussed in the last webinar and needs to be factored in when we're making decisions on staffing using the common staffing method. We need to think about the effect that decision that's taken about staffing and resources in one particular type of healthcare, where applying the common staffing method perhaps has on another type of healthcare, particularly if that service isn't using the common staffing method and isn't one of the named staff groups or healthcare types. So while this common staffing method is only required to be used in connection with certain healthcare locations and employees, it doesn't sit in isolation within an organisation, and there can be unintended consequences of recommendations for one service, and it's important that we therefore consider the wider system in any decisions that we make. The local context in which healthcare is provided is also important. So the calculators behind the staffing level and professional judgment tools are based on a range of service delivery models and are flexible enough to be adapted to most situations. Therefore, the factors which should be considered are those where there is something distinct in that clinical area that differs from the majority of areas providing a similar service. So some of those things might be where you have a particularly remote and rural area, or you have a different clinical environment. Again, thinking about significantly different service models, so where there's been innovative practice and maybe that service model is very different, there may be other considerations that you need to take into account. Next slide, please. So some further considerations, the needs of patients. So no two service users are the same, and the outcomes that matter to an individual will vary. Consideration must be given to the service user themselves rather than just their needs in isolation. Provision of appropriate clinical advice. So organisations must ensure that appropriate clinical advice is sought and had regard to as part of the common staffing method. And further information about this was provided again in the last webinar. Any assessment by Healthcare Improvement Scotland or any other relevant person on the quality of care provided. So the common staffing method requires that relevant organisations take account of any assessment in relation to the quality of care being provided in that type of healthcare. So what that means is that if there's been a scrutiny visit and there's a report and feedback around quality and safety, an assessment of quality measures, then this should be considered when you're looking at the common staffing method. Experience gained from using real-time staffing assessment and risk escalation. So again, thinking about the duty in 12IC to have real-time staffing assessments in place, the duty to have risk escalation processes in place, and the duty to have arrangements to address severe and recurrent risks under the Act should be considered. Comments by patients and individuals who have a personal interest in their healthcare relating to the duty to ensure appropriate staffing. So this includes feedback from patients and service users, their families or carers regarding the provision of safe, high quality care. It will be important that processes are in place to ensure that this information is collated consistently across the organisation. Comments by employees relating to this duty to ensure appropriate staffing are equally important and need to be considered. So any comments made by staff regarding whether there's appropriate staffing should be taken into account. So this may be through the process of risk escalation or through some of the feedback processes that are there to support some of the other duties. These comments made by staff using some of those existing opportunities. So for example, daily huddles, handovers and adverse reporting, as we've said, should be considered when you're looking at the common staffing method. Next slide, please. So once we have all that information, what needs to be done next? So firstly, we need to consider the information. So once all of this information for an individual area has been gathered, it's important that each of the factors is considered so that there is a detailed understanding of what the staffing requirement is and how that relates to the current staffing levels. Having gained this understanding, the Act then goes on to describe the steps that should be taken next. So then we need to identify and take all reasonable steps to mitigate any risks. So there's a requirement to identify any risks that exist within the current staffing levels, and then to put in place all reasonable steps to mitigate these risks. It may be that risks have been identified, but they're of an acceptable level or nature that can be managed locally and no action is required. The risk may also be mitigated in a number of ways depending on the level of risk. So, for example, issues with staffing may be mitigated by proactively reducing clinical activity within an area, but could also be mitigated by providing additional administrative support to clinical staff to release that time to deliver clinical care, or increasing the levels of relevant clinical staff. If after taking mitigation action, the level of risk is still not an acceptable level, then consideration of the risk of how this risk would be escalated in line with relevant organisational processes is required. So we have other duties within the legislation, including the duty to have a risk escalation process in place and the duty to have arrangements to address severe and recurrent risks that again address the actions and activities that would be required to respond to those. Relevant organisations should ensure that they have a risk assessment process so that across all types of healthcare covered by the common staffing method, there is a consistent approach to mitigation and escalation of risk. Then finally, we need to decide what changes are needed. So once these steps have been completed, an evaluation is required to consider whether changes to staffing establishments or the way in which the type of healthcare is provided are required. It's important that the impact each aspect of the steps is considered and any differences, for example, in the output from the specialty specific staffing level tool, the professional judgement tool and feedback are investigated to enable a detailed understanding of the staffing requirements and how that relates to the current staffing levels. Following the use of the common staffing method in each setting, in which it applies, relevant organisations should use existing governance processes to make staffing decisions and implement any changes as determined following the use of that common staffing method. Thank you. I'm now going to hand over to my colleague Sarah, who will talk about the final part of the common staffing method, which is training and consultation of staff, and then the role of Healthcare Improvement Scotland following enactment of the legislation. Thank you.
Thank you, Catherine. So the next section we're going to go on to is 12IL. And again, this is related to the common staffing method. So it's training and consultation of staff, but this is training and consultation specifically in relation to the common staffing method. So firstly, organisations must encourage and support employees to give their views on staffing arrangements. And that is for all the types of healthcare covered by the common staffing method. And you remember those are the ones that are listed in the table in 12IK. Having sought those views from employees, they must take account of and then use those views. So this will enable identification of the areas of best practice. So these can be shared across the organisation, but also equally important areas for improvement in staffing arrangements in those areas where the common staffing method applies. So in practice, this will mean that a process will need to be in place for staff to be able to provide their views on staffing, for any areas of good practice to be identified so they can be shared across the organisation, and any challenges identified. And all this information needs to feed into decisions made as a result of applying the common staffing method. And this process should make links to existing governance, professional and partnership structures. So organisations already have staff governance systems, so these could be used to solicit those views and then to feed those back into decisions made as a result of the common staffing method. Next, that staff who are using the common staffing method need to be trained in its use. So this covers all the staff who are involved in applying the common staffing method. So for example, those who are applying the staffing level and the professional judgment tools, individuals who may be providing clinical advice, and also individuals who may be identifying and mitigating risks as part of that method. Obviously, the training required will be very dependent on the level of involvement in the process and the role that that individual plays, and also their current knowledge and understanding of the common staffing method. Staff must also receive adequate time to use the common staffing method. Again, this will apply to all employees who are involved in its application. So, for example, you have those who are running the tools, using the staffing level and professional judgment tools. They will need time to do that, as well as time for providing clinical advice and also for identifying risks and making those staffing decisions. Next slide, please. So also in terms of this is staff giving their views, which we considered in the last slide, and training of staff, but also relevant organisations need to feed back then information to staff about the common staffing method, how they've applied it in the area and the results. So this includes results from using those staffing level and professional judgment tools. So for all the areas of healthcare listed in that table in 12IK, each ward and each team, staff working in those areas should be given the results from using the tools. They should also be given information about the quality measures that were used and all those other factors that Catherine listed in the couple of slides, and how those factors were taken into account when using the common staffing method. Staff should also be given information about the risks that were identified as part of using the common staffing method and what mitigation measures have been or will be put in place to mitigate those risks. And then finally, staff should be given information about decisions made as a result of using the common staffing method. So these could be decisions about staffing levels and whether they're going to change, or whether there should be a change in how the service is delivered as regards the service delivery model. So as required by the staff governance standard, staff should be engaged and involved in decision making which affects them, and that will include in the common staffing method. So there needs to be a mechanism within the organisation to give accessible and timely feedback to staff after the common staffing method has been used and any decisions that were made as a result. Next slide, please. So as we covered in the previous two webinars, we talked about the annual reporting that health boards will have to do to the Scottish ministers. So the Act requires that at the end of each financial year, all health boards, the relevant special health boards and NHS NSS will have to submit an annual report to the Scottish ministers. And that details how they have carried out their various duties and requirements under the Act. So the information in this reports will enable monitoring of the impact of the Act on the quality of care provided to patients along with the well-being of staff. And obviously, the Act is coming in next year, so we want to enable how this Act impacts on the quality of care through the monitoring processes. It will also enable areas of good practice across the board that can be shared. Equally, it will identify any challenges that boards are facing in meeting the requirements of the Act, and also detailing what steps they've taken or will take to address these. And looking across the boards across Scotland, we can identify trends. So, for example, there could be common challenges related to particular duties in the Act or particular service areas. The reports will also identify any improvement support that is required and will also inform the Scottish Government policy on workforce planning and staffing in the health service. And this will be considered, these reports will be considered alongside all the other sources of data about staffing in the health service. So these reports received by the Scottish ministers, they must be collated and then laid in an overall report before the Scottish Parliament. The Scottish ministers must also lay an accompanying statement, and this will detail how they have taken into account or will take into account the information received in those reports when they are designing policies for staffing in the health service. Next slide, please. So when we're looking at reporting, Section 12IM of the Act requires health boards, special health boards and NHS NSS to report on the various requirements in the Act. And these are all listed on the slide here. Now, the duties highlighted in the purple are the duties that we are considering today. So that is 12IJ and 12IL, which is the duty to follow the common staffing method and the training and consultation of staff. And these are the duties that we're going to look at in terms of the reporting. So when we're looking at the duty to follow the common staffing method and the associated training and consultation of staff, organisations will have to report on how they have carried out those two duties across that financial year. Whether they faced any challenges or risks in carrying out those duties, and the steps they will take to address such challenges. Now, in order to ensure consistency of information across all the organisations, they will be provided with a reporting template from the Scottish Government to complete, and that will also have associated guidance on the type of information and details that should be included. Now, we are currently undergoing testing with a number of volunteer test boards at the moment, for the statutory guidance, and that will include them testing our draft reporting format to ensure that when we introduce it next year, it is user-friendly and it captures the information in such detail as the Scottish Government requires. Next slide, please. So the second topic we're going to look at today, after the common staffing method, is the role of Healthcare Improvement Scotland. Now, HIS had a number of specific responsibilities detailed in the Health and Care Staffing Scotland Act. So first of all, they are required to monitor the compliance of organisations, and that's the health boards, relevant special health boards and NHS NSS, on how they are carrying out their duties under the Act. So this is in addition to the reporting requirement, the annual reporting requirement that goes straight to the Scottish ministers. HIS have a role which is allied to their existing quality assurance responsibilities in monitoring how organisations are complying with their requirements. Secondly, he's responsible for monitoring and review of the common staffing method. Obviously, we want to ensure that the common staffing methods still remains contemporary, fit for purpose and relevant to the types of healthcare that are being delivered. And so his has a responsibility to keep that under review. Allied to this, they also have responsibility for monitoring and development of those staffing tools, including a duty to consider multidisciplinary staffing tools. So most of the staffing tools that are used in the common staffing method at the moment, as we said, it relates to those three groups: registered nurses, registered midwives, and medical practitioners. But what we want to look at in the future is whether those tools should include other groups. So that could be our allied health professional colleagues, psychologists, etc. Health boards, relevant special health boards and NHS NSS also have a duty to assist HIS as required in order that HIS can carry out all of their functions. So HIS needs to be able to monitor compliance, it needs to be able to monitor the common staffing method, etc. And all those organisations have a duty to assist HIS to be able to do that. The Act also introduced a power for HIS to require those organisations to provide any information to assist it in carrying out its functions under the Act. So we'll now look at these roles and responsibilities more closely. Next slide, please. So first, when we're looking at monitoring compliance, so the Act states that HIS is required to monitor how those health boards, special health boards and NHS NSS have discharged their duties required of them under the Act. And these are the duties they have to monitor, which are listed here. So you have your duty to ensure appropriate staffing. We're looking at real-time staffing assessment, risk escalation, severe and recurrent risk, seeking clinical advice on staffing and giving adequate time to those clinical leaders. Duty to ensure appropriate staffing with regards to training of staff, following the common staffing method, reporting on staffing, and ensuring that organisations are having regard to that statutory guidance that is issued by the Scottish ministers. Next slide, please. So why are we monitoring compliance? Well, again, similar to the reporting, monitoring compliance carried out by HIS will enable them to identify areas of good practice. We want to share that learning and we want to target improvement support to those organisations and areas where it is required. But it also provides good intelligence. So the intelligence that HIS will get from monitoring compliance will be useful for HIS in deciding whether it's necessary to review those existing or develop new staffing tools, maybe amend the professional judgement tool or the common staffing method. So the Act doesn't detail how HIS has to do this. It doesn't detail that they have to carry out inspections at any particular frequency. That is left to HIS to decide what would be the most useful way to monitor compliance and for them to incorporate that into their own processes. But it must include monitoring all the duties listed on that previous slide. And HIS also must take account of any statutory guidance that is issued by the ministers. And this is something that HIS are looking at testing at the moment. Allied with our testing with the health boards, HIS are looking at how they would test their duties and how they will be able to operate those when we start the Act next year. Next slide, please. So the second of HIS's duties is the monitoring and review of the common staffing method. So for every type of healthcare that is listed in section 12 IK, so that was your table that we saw a few slides ago, HIS is required to monitor the effectiveness of the common staffing method, and the way in which relevant organisations are using that method. HIS must carry out a review of that common staffing method and its application, and the frequency isn't dictated in the Act, it just says it is from time to time. Now, Scottish ministers can direct HIS to carry out a review, but in practice it is anticipated that HIS will decide on this frequency. And this will be considered by assessing the way in which relevant organisations are applying that common staffing method, the appropriateness of the application of the method, analysing intelligence made about decisions made as a result of that method, and the results that are coming out of the application of the common staffing method. Now, is it important that when HIS carry out a review, they do this in collaboration? Because obviously a review of the common staffing method needs to involve the people who are using it and other interested parties. So the Act lists a number of parties that HIS must collaborate with when undertaking that review. And that consists of the health boards, the special health boards, integration authorities, NHS, NSS, also trade unions and professional bodies that are representative of employees, the professional regulatory bodies, any other providers of healthcare that HIS considers have good experience of using staffing methods and staffing level tools, and also the Care Inspectorate. When they're undertaking a review of the common staffing method, HIS must have regard to the guiding principles for the health and care staffing that are set out in the Act to make sure that the common staffing method keeps aligned to those guiding principles. So once they've undertaken a review, then they can recommend any changes. The purpose of this review and the recommendations is to ensure that the common staffing method remains contemporary. Common staffing method needs to work in practice across all those different staffing areas and employees. It must give reliable results, and it must be helpful in terms of deciding what those staffing requirements are. So once it's completed its review, it may recommend changes to the common staffing method to the Scottish ministers, and it will do this by submitting a report and then publishing that. And the report will say what it has done, what recommendations it has for changes, and the reason for this. The purpose of publishing the report is allied with the guiding principles in that anything we do is transparent and allows people to read what the recommendations are. Next slide, please. So the next two duties within the Act are about the monitoring and development of staffing level tools. So a staffing level tool and the professional judgment tools are a key requirement of the common staffing method. So it makes sense that if you're reviewing the common staffing method, you also need to review those staffing level and professional judgment tools. And again, this is to ensure that they remain contemporary, they give reliable results, and they work in practice across all the different types of healthcare that are listed in the Act. So having done a review, if they consider the tool is no longer effective, then HIS must recommend its revocation and replacement to the Scottish ministers. And again, this ensures that we are using tools that are helpful and give reliable results. No frequency of monitoring is stated in the Act. That will be determined by HIS's expertise, using intelligence from how relevant organisations are using the tools, looking at what the tools are outputting, but also considering any significant policy or practice change in the speciality to which the tool applies, which could lead to the tool needing to be revised. In practice, HIS will routinely review and refresh the staffing level and professional judgment tools on a cyclical basis. And that ensures that they will remain contemporary and function effectively. HIS may also develop a new tool. So they may develop a new or revise an existing staffing level or a professional judgment tool, and that's in relation to any kind of healthcare provision. And they can recommend that to the Scottish ministers. Again, it's important that HIS works in collaboration. And again, they must consult those same parties as they did with the common staffing method to make sure that any recommendations they are making will work across the board. Again, they must take into consideration the guiding principles set out in the Act, but also any other guidance that they consider appropriate. Now, this could be guidance that's published by relevant professional bodies or other relevant bodies, but also could be clinical evidence and research about the use of staffing level tools or professional judgment tools. And again, this is always to ensure that all the tools that organisations have to use are contemporary and appropriate and fit for practice. Scottish ministers can also direct HIS to develop a new or revise an existing tool. And again, this just follows the same process of collaboration as we just discussed. Now, the purpose of the Scottish ministers recommending or directing HIS to develop a new tool is to ensure that the ministers can prioritise develop in line with any Scottish Government requirements regarding the provision of healthcare. It's important that when any tool is developed, HIS are required to consider whether this should be multidisciplinary. So at the moment, the tools really only relate to those three professional groups. So you've got the registered nurses, registered midwives, and the medical staff. However, we all know that care is delivered in a multidisciplinary manner and involves more than those three groups. So, for example, allied health professional colleagues, psychology, healthcare scientists, etc. So when any tools are being revised or considered for the future, HIS has a specific responsibility to consider whether these groups should be included. So would any new tool need to be consider all the professions, so be multi-professional? Next slide, please. So the Act also gives specific powers to HIS regarding information collecting. So obviously HIS needs to be able to carry out its functions under the Act, and that's all of its functions. It's monitoring of compliance, relating to the common staffing method review, and also relating to staffing level tools. So there is specific provision in the Act that states that health boards, relevant special health boards, and NHS, NSS must provide such assistance to HIS to enable it to carry out those functions. Allied with this, there is a power that is given in the Act that allows HIS to serve a notice on an organisation to provide it with information to enable it to carry out its functions. So, for example, if HIS needs a piece of information to be able to monitor compliance with the Act, by a specific organisation, then it can provide that organisation with a notice to require it to give that information. Now, this notice must specify the information that is required. It must specify a date by which it must be supplied, and it will also explain why the information is needed and what function it relates to. So again, using that example, if it relates to, for example, assessing compliance under the duty to ensure appropriate staffing, the written notice must state this, and it must explain how the information is related to the compliance with that duty. Next slide, please. So just to finish up our presentation today with a note on the public consultation. So as we stated in the beginning, we have drafted statutory guidance along with our stakeholders, and that has now been gone out on Citizen Space for public consultation. So if you go to Citizen Space, you will see the consultation listed there. You'll be able to read the draft statutory guidance, and then you'll be able to respond to a number of questions. And that's providing feedback as to whether it's clear, whether you understand it, and whether it contains relevant information to enable you as an organisation to implement the requirements of the Act in your specific setting. We want to hear your views. We need a range of views. When the Act comes into force in April the 1st, organisations will have to have regard to this statutory guidance. So we want to make it as best as possible. We want it to be useful. We want it to give relevant information. Consultation will be open until mid-September, so please go along and have a look and provide your views. So thank you very much. I'm just going to hand back now to Hiz, and they will give you more information on more resources and how to get in touch with us if you need to.
Thank you so much, Catherine and Sarah. I have really enjoyed these webinar series. I love the way you break all the legislation down, and every time we come onto a session, I pick up these other nuggets to take forward. So they've been so helpful. Thank you very much. Before we draw to a close, I would like to take this opportunity to just draw your attention to some additional resources that might help you in your preparation for enactment. We have developed a knowledge and skills framework for health and care that's available on the Tourist platform. There are currently informed and skilled resources there. They're quite interactive, and I think will really be helpful for people to access and let them know what they need to know for the registration within, for the legislation within their own roles. I hope that you would access them yourself, but also signpost them to your colleagues that you think might be helpful as well. In the live session, the links to these would have been dropped in the chat, but I'm happy for you to contact us at HSP. The email address will come up in another slide, and we'll happily signpost you to any of the resources that have been mentioned in this session today. Next slide, please. We would normally be asking for your feedback as well, but we'll not be doing an evaluation in this session. But would again ask that we direct you to the consultation, and we would be really keen to get the your feedback on the guidance. So that link is available as well. Next slide, please. And happy for you to keep in touch if this session has raised any questions that you want to get in touch with us any further, or if it's just to access the resources that we've spoken about throughout this session. You can email us at HSP, or we also have the email address there for the Act implementation team if you've got any other queries around the consultation. And with that, we will bring this session to a close. Thank you very much for taking the time out to watch it. We hope you found it useful. Thank you.